Hello everyone, welcome to the AIPT USA. This is Karthik Yadagiri, your physical therapy doctor. I hope you're following along with the treatment options in different videos. Now we're at the cervical spine area. So in this treatment video, you will see different techniques. I mind you, you have to be careful, especially with the cervical spine. Make sure there are no red flags and make sure the patient does not complain of dizziness or had any kind of issues with stroke or symptoms like that in the past, and they did not complain of dizziness, nystagmus, or anything where you can suspect a cervical artery dysfunction. You should not be doing these techniques. But the easier techniques, which I'm going to show you, are mobilizations, which work wonderful at the cervical spine. It's a PA and a UPA. So remember, this whole treatment options was to find the concordant sign and treat it. So the PA is CPA is the central posterior to anterior. You can use different oscillation methods. So let's say she has headache, you would treat C1, C2 based on where the concordant sign is. If she has trouble at C3, C4, C5, C6, any of those areas, you can do a CPAs. So the way I do it is take up the slack of the neck, use two of my thumbs, put them right at the spinous process and gently push him down. See what her restrictions are, and she complains of pain. Danielle, do you have any pain when I push down?
No.
And I keep going down. Any pain when I push down?
No.
And then pain when I push down?
No.
Any pain when I push down?
No.
Typically, it's right around C2. Any pain there?
A little bit.
A little bit. So at that area, if that's similar to her pain, I would just gently oscillate downward in the posterior anterior direction till she feels like she's getting better. I'll keep constantly asking if she's feeling better or worse or about the same. Does it feel better, worse, or about the same?
About the same.
Feel better, worse, or about the same?
A little better.
So you continuously keep on going with the process, and then you can find the segments on the side, which is unilateral. The transverse process of the facet joints, you can go push straight down. It doesn't matter which angle. There's a 45-degree orientation, but don't worry about it for now. So just use two thumbs, one on top of the other, and push and oscillate. You're going to the restriction from one restriction to the other and stay in the middle. It's all based on sense. If they're severe irritable, don't do it. Go very slow. So based on that, you push. So just take up the slack, put your finger, and oscillate. So that's one of the treatment options. You can use your IHTM tools for treatment of the cervical spine and the thoracic area. You could also use cupping for that. So you can use the tools in such a way that if they have pain in that area, we can do it in sitting or in laying. And most of the time, they'll have trouble in the thoracic area. That's when you use these tools. And as you can see, the pressure is not too much in this area, but slow, sustained motions of the thoracic spine. I would do it on the skin, not on the clothes, because I want to go get the pressure all the way. So this is one treatment option. You could also use cupping, but I typically use cupping with movements, so I'll show you that way. So go ahead and lay supine. So this is the technique that really works wonders for most of the people with neck pain. Scoot back towards me all the way. So this is the manipulation technique. So you want to make sure you have identified the segment that does not move well or is uncomfortable. So you want to put your fingers in that area on both sides. Stay really close. Don't put your hands on their ears. You have to be under that. So you have to have the lateral part of your fingers on the facet joints where there's restriction. You go to the side. So they have trouble side bending to the right. So you go side bend to the right and rotate in the opposite direction. I don't want you to turn quickly. This is not a steering wheel that you turn. You gently go, feel the end of the slack and go back off. You gently rotate and move, oscillate, and quickly do a snap. You can do it on both directions. It's very safe. That's it. You don't want to turn them. No turning, because just feel for it. You don't want to get at the end range. You don't want to mobilize it or manipulate at the end range. Just in that area, gentle motion, quick whip, and that's it. That's one of the cervical spine technique for neck pain, DJDs, DDDs, all these diagnoses, you can work this. If they have radicular pain going to their arm, I would not do this. If the symptoms are just about the elbow and the little tightness here, I can do this. But they have tingling and numbness in their fingers, I would not do it. That's a separate video for radicular symptoms. All right, go ahead and slide down. The key to the cervical spine is improving control. I could do this by using a biofeedback machine. You can use your blood pressure cuff. I've already pumped it up to 20 millimeters of mercury. So I put that at the nape of the neck and the head, just in the gutter. So as you can see, we've already tried to fill up the pressure to 20. You want to start there. You want to teach the patient how to dissociate upper cervical and lower cervical motion. The patient can hold on to it, where she's going to tuck her chin in, and we'll see how far she can go. Just for demonstration purposes, go ahead and tuck your chin in. Tuck your chin in and let go. Tuck your chin in. As you can see, the measurement goes up. You don't want it to go too far. You want her to try to control at 22, 24, 26, 28. But initially, see what she can do. She should be able to breathe and control. That teaches her stability and control. That's one option to use, and you can increment by increasing the time. Holding time from 10 seconds to 30 seconds to a minute. If they're able to control 22, 24, 26, 28, and they're able to hold it for 10 seconds to 30 seconds, and do it about at least 5 repetitions, they're doing a great job, and you can progress them. So that's one treatment option. The next one is in motor control strategies to improve the cervical spine. I can ask them to tuck my chin in myself, lift it up, and they slowly, eccentrically control their head. That teaches them control. And also there are motor control exercises, but I'm not going to mention all of them because there's a lot to do. But one thing that is very helpful for patients is awareness of where their spine is. So go ahead and sit up and face that way. I could do IHTM in this position too. That's one treatment option. So this works well if I want to do it on the neck, where most of the patients complain of pain around here. So you kind of gently work on the tissue all the way from the top to the bottom and all the way to the thoracic. You're not forcing it, gently moving. If they are too sensitive, I would just put it flat to desensitize the area. But if they're okay, I can do gradual motions down and up to improve mobility. I can also do it with motion where they have trouble turning to the left. I can ask them to turn to the left and still continue with my strokes. They can go back and forth. So they can keep turning and I can still continue to move. That's another treatment option with the tool. The best motor control exercise for them is using a band and getting awareness of it. You can use a TheraBand or any band. So you can ask them to hold with their hands, tuck their chin in gently, pull gently so they're not going too forward. They are controlling the motion. You don't want them to pull too hard. Gentle pressure improves a lot of feedback. So they gently turn their head side to side to improve control. So you want to make sure they can either do it in front of a mirror, so they're doing it right, so they're not compensating every other way. So you want to do small motions so they get more control first before range of motion. That's another option. They can use it holding to the side. They want to just hold it one side and then turn the other way. We'll give you resistance as well as feedback.
Sorry, I can't search the web on Apple Watch.
So that is okay. So you can let go of that. There's also new techniques which I'll show in subsequent videos where we have put pointer lasers on their head and they can turn going from one point to the other, where laser will be a good feedback, which we'll cover in subsequent videos where we're covering cervical spine for SFMA. With this, we conclude our treatment techniques and options for cervical spine. If you have any questions, please post your comments and below and subscribe to the channel. Hope you have a good day.